What's up, you guys? This is Boy Miguel giving you your daily dose of radiation. Today's video will cover X-ray tech versus a nurse in the emergency room. So to give you context, I do X-rays at night, 7 on, 7 off. I work a lot of day shift, a lot of overtime. So I know what you're saying. You're like, Miguel, how can you speak about both worlds? My lady, certified nurse. So every single day I get an insight on her world, and I've dabbled and I've asked many questions. And just based off of my experience at the facility, I have a good knowledge on both worlds compared to some people who are just basing it off of what they see. My lady actually does it, and I followed her one time with her jobs, and it's difficulty. So in context, as far as difficulty goes for ER versus both, I would say X-ray is more of a situational stress versus nursing it can be a double-sided sword as far as the stress level, especially for night shift. So usually if it's slow and it's not busy, you will have way less orders in X-ray. And then maybe certain nurses don't have patients, so they're helping other nurses, and it kind of slows and it becomes easier for them. Usually our responsibility most likely is like, go take an X-ray and then for like 30 seconds of work, and then we chillin', versus the nurse has to do the whole shebang, whole report, get context to what's going on, draw the blood, talk to the doctor, see what he wants to do, deal with the patient. Like, it's a bunch of stuff. But at the same time, even though we could essentially have every single patient in the ER have an order. So we could have anyone. On top of that, you have the stress of the floor department, like all the hospital, you have to deal with them. They get sprinkled in on top, which the ER nurses don't have to deal with that. The most they have to deal with that if their little patient in the ER is being transferred to the floor. That's where they have to interact with the floors. Besides that, they don't have to. So occasionally the ER will be dead, but we're still busy working while they're just chilling because we have to deal with the other departments of the hospital. So that could be another way you could dabble in. Same thing with the nurses. If like the patient is stable, it's good. It's chill. Like, it be a smooth thing. But once he starts coding, can't breathing, it can get very hectic, especially in the trauma room. Which, like, sometimes they'll be doing like blood work and they'll be getting rapid. They'll be doing so much stuff and then we're just chilling in the back like, alright, well, tell me when he's stable, so we just do our 30 seconds of work and get this X-ray so you can see if he's intubated or like, it can literally will be vice versa. Now, as far as like pay and stuff, we're almost close to the same depending on your level of experience, but depending on if you're like LVN or RN, BSRN, like your pay could be more than just the basic X-ray tech. It could be vary from a few dollars to, if like you're a BSRN in the psych, you can even push even more money than X-ray. So in a sense, nursing do make more money than we do. But it's always, at the end of the day, more money, more problems you have to deal with. So it's a double-sided sword. Once again, we as X-ray techs deal with radiation versus the nurses really don't dabble in radiation. The most they get is if there are patients there and they're doing something and they don't want to leave the room, or maybe they have to let up because they're doing something important and they can't leave. They could get some radiation, but we're in the field of radiation, so we dabble with it all day, all night. So that's something to keep in mind. So as far as us intertwined for X-ray nursing, it happens I would say on like a 50% basis compared to like if you do CAT scan, they are more closer because the blood work and like the stability of the patient coming down and help, it could be like way higher as far as the interaction that goes. As far as like even with doctors, if they put the order in, unless the patient can't do it or we're struggling or something like that, then we'll reach out to the doctor. And that's usually about it. We don't really do much compared to the nurses. They have to be there, give them a report, tell them what's happening, and it's just a lot of stuff. Even like between shifts, the report you have to give, my lady would tell me, depending on how many people you have, it can be between an extra 15 minutes to like 30 minutes of just day shift and night shift communication. Versus like X-ray techs, if there's nothing going on and everything's working, it can be literally like, you gooch, everything's good. Tag you in and you just bounce. Literally, that's how simple it can be. Compared to the most worst situation is like, hey, so and so called, hey, so and so in the ER needs post intubation, or hey, portable so and so isn't working. That's like the worst case situation in that. And yeah, hope this gives you an insight on both worlds. And yeah, it's been your boy Miguel. See you on the next one.